Hello, everyone. Welcome today. How is everyone on this fine Wednesday afternoon? I almost said morning. I'll take that as everyone is doing great today. We're having a wonderful day. Oh, there's some thumbs up things. Good to see everyone today. Thank you for joining us. I always appreciate how we get such great participation and have such large groups for our discussions here. But there are so many people that are all willing to participate and helping to improve our community here. Okay, we will go ahead and get started today. If you want to go to the next slide, please, Matt. So today, as we've got listed out there, I'll just read those out quick. The purpose of our meeting is, and some of this is a little bit of a review, but really we're just going to kind of solidify these and give one last opportunity just to put that out there, and then we don't have to necessarily come back to all of these things every single time. So if you do think, gosh, you know, we talked about that last time or the time before. Oh, I see Tammy. Are you the only one getting feedback? I know it says Paul, but I see your picture there, so I know it's Tammy Jackson. Can everyone hear clearly? Or is okay? I'm not sure what it is, Tammy. I don't know if you have, there's another microphone you have on that's giving you an echo nearby or something. But anyway, so if you think, gosh, you know, we've talked about these things a few times, we really, because we have such a broad group, it's important to us to make sure that we bring it up more than once, just so that everyone knows and is clear as to where we're going with our ideas. We have, you know, consensus buy-in for these types of things, and understanding in a large group here, we've got, you know, just shy of 50 people on that not every single person may agree to the exact wording of everything that we're doing, but I think I know we've done a really good job getting general consensus on the items that we've talked about to this point. So again, we'll talk about our name and claim of work moving forward. We want to refresh our knowledge and where we're at. So just getting back up to speed again, because I know, again, with such a large group and with everyone's busy schedules, not all of our participants have been able to make every single meeting. So it gives us an opportunity to kind of catch back up. What have we discussed since maybe the last time you had a chance to join us? And then, you know, to be able to get you back up to speed and move forward. Then we want to discuss our impact statement. So that's one of the newer pieces that our group has been discussing. Get your feedback on there. We'll do some breakout groups, and then talk about our collective impact survey. So that is really our goals for today. So if we go to the next slide, I'll turn it over to Nadia just to give us a little bit of an update on some of our progress.
All right, thanks, Travis. And I will just echo that. Thank you to everyone for joining us. We're just going to go briefly through a few of the cornerstones of our work that we have used and referred back to throughout this process. So you may recognize this collective impact model. And the most important parts of this are understanding the different areas. So in the isolated impact, we have a lot of great initiatives, a lot of great projects that are happening. We have some duplication of efforts, but for the most part, there's not a whole lot of coordination into a collaboration or a partnership, which we see a lot of in our community. There is agreement and excitement around a common topic, but many times the work is limited to a certain scope of people, and there is not alignment or shared measures and accountability. So the area that we're really trying to guide our work into is that last column, which is collective impact, where all of the relevant actors work towards the same goals and measure the same things. And there is alignment that includes all scopes of community, and the actions are very coordinated. So if you want to go to the next step, Matt, or the next slide, sorry. So as a collaborative, you have adopted the results-based accountability model to help lead the community conversations around impact and reaching our intended results. Just as a refresher, the results-based accountability relies on 3 questions. How much we do, which everyone does a really great job of collecting that, the number of people that you serve, the number of services or activities that are performed. The second question, how well we do it. So the percentage of those activities that are performed well. And then the final question, which is really the most important one that we're trying to gear our questions to, is anyone better off? So what improvement have we seen in skills, attitude, behavior, and circumstances? Next slide, Matt. Sorry. So a 2030 vision steering committee with members from across Buffalo County did a deep data dive and compiled data to share with the community, leading to the development of 4 areas of performance indicators. And those 4 areas are behavioral health, early childhood and adolescence, access, and vulnerable persons. So as you can see in this first slide, regarding behavioral health, some of the areas where data was compiled focused on depression, mental wellness, substance abuse. And the next slide gives a little bit of more details on access to basic services, and those services included things like mental health care, housing, and food. The next slide for vulnerable persons. This included minorities, included individuals under poverty levels, and those with chronic diseases. And the last one, I think we missed one in there, possibly. There we go, early childhood and adolescence, which focused on protective factors like school safety, trauma-informed care, again, mental health, and social media. So those are the performance indicators that were laid out with that data that was collected. And this work has set the community health and wellness indicators with data to establish a baseline metrics for your collaborative. So if we can go to the next slide. All right, thank you. So as a collaborative, you have adopted these vision statements. In 2020, 60 community partners brought their hopes for their community to Buffalo County Community Partners Board to help build a vision for 2030. And so these vision statements focus on these areas that we will have resources that are easy and to understand and accessible to all, that all residents will have access to basic services, that we will thrive when our partners work together to coordinate services, and that the voices will inform our work, and that we value all people. Next slide. So in looking a little deeper at those vision statements, we can see a list of gaps and barriers and challenges. And those were the questions that we asked when those 60 community partners came to our community partner board. We asked them, what are the gaps and barriers and challenges that you see in our community? So in the area of resources, partners shared how important it is for resources to be easily accessible, evidence-based, and to span across a lifespan, to serve across the lifespan. In many cases, we found that resources were best shared by a friend or a trusted adult. And the one thing that we learned through the pandemic was that those in crisis, that was brought to light even more so, is those in crisis reach out to a trusted friend, and the resources were not easily found or understood when they were in crisis, when they are in crisis. So how do we work together to prevent the crisis and use different language to reach those most at risk? When someone is in crisis, it is very difficult to navigate a web page. learn of all the different community resources, which one apply to you, make multiple phone calls, and reach the resource that you need. Next slide. As far as gaps in access, partners have listed barriers to services and unmet needs to help guide our conversation. So accessing food, for example, when working 3 jobs just to pay rent, can be very challenging for single parents. Noticing unintended challenges in our community can help open doors for those to become self-sufficient. So during the pandemic, our community delivered 1 million food boxes, which is a tremendous success. However, we began asking ourselves, are any of those individuals who received those food boxes better off today? So that third question in RBA, in the process of distributing those food boxes, did we get a better understanding of those individual needs? Did we connect them to additional resources? Did we help them to create a sustainability plan to where they were better off after receiving that food box? So that was a gap that was identified. In the next slide, as far as gaps in coordinated services, partners shared how work is happening, however segmented, and it is not broadly recognized. So we heard from youth and adults asking for more organic and genuine conversations to help build connections around services and programs. An example is that youth gathered and met with executives at Richard Young Hospital, Life Skills Counseling, and Safe Center to share their understandings of programs and services, which really opened the door for those programs to bring more education to youth while improving their programs, considering their voice as an end user. And in the next slide, in regard to gaps in the voices that inform our work, we heard partners ask that more connections and relationships be built with rural communities, that schools and marginalized communities are oversurveyed. And it was difficult to hear the voices of those with lived experience in order to improve community programs and services. So all partners asked for a system to track and communicate gaps in our community. Many gaps are being discovered in the work of the community response team due to the efforts to support those with needs who are unable to find any other solutions in our community. And to harness that knowledge that the community response team has put together and share that with others would be a win for our community. So next slide, I believe, is back to Travis.
Thank you for going over all of that. That was really awesome. I mean, for you to be able to summarize in like 10 minutes the work that's been going on for a couple of years and to know all that we've accomplished, it's really great. So again, I know that sometimes we are redundant in the way that we want to communicate and make sure that we are over communicating and giving a voice to everyone, but there's a lot that we have accomplished and that we're going to still continue to accomplish, team. So I think it's pretty awesome. So this infographic, I know that this shouldn't, but this infographic excites me. I like how this has come together. I'm not sure which staff member has the ownership of creating this, but I give them a huge kudos because I know as we have given feedback, this graphic has evolved, and I think it is very concise and it accurately captures what we're all doing. If you take a look at the top there, one of the things that was part of our meeting purpose today was be able to just name our claim to our work. And so we started that a couple of months ago, and we have decided that the Buffalo County Wellbeing Collaborative is our official name, which probably isn't isn't a surprise because we've talked about that a couple times. But I'll tell you, we've gone back and forth on whether or not we should hyphenate well-being. And I'll tell you what, team, after much discussion, and we've beaten each other up back and forth about it, we have decided that we will hyphenate well-being. So I jest a little bit there, but I know that there was some discussion there. So I appreciate that we were able to be able to come to that. So you are the Buffalo County Wellbeing Collaborative. So thank you, everyone, and thank you for being a part of that. So I'll just kind of walk you through that, and I'll start with that piece there. So you see that large circle around our areas. That's you, that's this group, that's this team of, right now we've got 51 people on here today representing different organizations. So if you look over to the box on the right there, it says the full collaborative. So we don't have all of your individual organizations listed, but we wanted to make sure that we had a broad representation of agencies and disciplines on there. So I believe we have captured all of those different disciplines or agencies on the right there. But those are the people that are making up this collaborative. So we have a very diverse group, diverse representation, so that we hopefully don't have any gaps when we're representing these different areas. So, and as Nadia talked about, we've got behavioral health, vulnerable populations, children and youth, and access. And when I started this work a few years ago, the amount of data and information that we had around this, it was just very raw data. And so we've gone through and we've been able to organize that data to put it into these 4 different areas, and then to get to the point where we now have these impacts. And to me, it's really powerful. I remember a couple of meetings ago, I was in a breakout group with Josh Arias, and he was talking about one of his youth programs and how they have switched from kind of this outcome model to more of an impact model. So when I say that, of course, what I mean is they used to measure, okay, well, we had 20 kids go through this program, which is great, that's successful. You want to make sure that you have people coming through the programs and that your programs are sustainable. But when he started talking about the impact model and talking about how the program has actually impacted the people who have come out of those programs, it kind of blew my mind. It was just a change of a mindset. It's not about, again, how many people you get through a program, but what is the impact? So that's really what we're going to spend a lot of time talking today about, is what are those impact statements? What does that look like? And is it accurately capturing everything? Because our impact statements will be the same for all of these areas. So it's not an impact statement for vulnerable populations versus access, but it's broad in its nature to be able to capture work that needs to be done within all of these different areas. And then just a little bit with the structure as well too. So we've got the Buffalo Wellbeing Collaborative. Then there's a smaller subgroup of this collaborative that helps to keep us organized, helps to keep us progressing along. And so one of the things that the steering committee has asked, and that we'll be working with the staff on, is we want to understand where we're at. So where have we come from? And I think we do a good job outlining that, but how long has it taken us to get to this point? Where are we at within our current work? And then what can we expect in the timeframes going forward, whether that's 6 months, 12 months, 18 months, and then ultimately by 2030. So what does that future look for us? What are we constantly working towards, and are we hitting those timelines and those measurements? So that's where the steering committee comes in. They can provide that strategic vision and support to continue to make sure that when we meet as this larger group here, that you've got the support, you understand the vision, and we can keep working towards those impacts and those results. And then, of course, none of this can be done without the help of Buffalo County community partners and their board. So they're really the backboard for what we're doing here. They're going to help us kind of capture and organize ourselves around the planning and measurement, take a look at resource. So they serve kind of a dual purpose, where we have staff here who are helping from Buffalo County community partners who are part of the steering committee, but we also have programs within Buffalo County community partners which are going to affect and have impact as well too, much like the rest of you on this call from your different agencies and disciplines. So that's how we all play together here. But for this broader group, just know that this is it. This is the team. We're going to be the ones who have discussions around what these impacts look like, our impact statements, and continue to carry the work forward. So that's a lot. And I'm really excited about all of that. So I apologize if that was very fast, but are there any questions or feedback at all right now on, I guess, our name, the Buffalo County Wellbeing Collaborative, and to hyphenate or not to hyphenate, and or any of the other information that I covered related to this infographic? And you can put those in the chat too if you have any questions. Okay, and if anything does come up, again, please feel free to reach out to myself or any of the staff or Nadia, or put something in the chat. We'd be happy to go over any questions you may have. I understand that with a group of 50 participants, sometimes we shy away a little bit from asking some of those questions in a large group setting. Okay, if we'll go on to the next slide here. Want to get a chance to go over our impact statement. So again, this is where we live in the middle with the impacts, with all of those areas around access, behavioral health, vulnerable populations, and children and youth. So we talked about these, we've taken a look at it. We've come up with 2 impact statements. So what we want to do is we want to be able to increase access to information, resources, trainings, programs, and services. So as I say that, and as you're taking a look, or as you're thinking back and reflecting on those different areas, does that accurately capture everything? And then for the second impact statement, so prevent persons, whether that's children, youth, adolescents, older adults, or whatever segment of population that is, from entering the system. So we want to get to a point where people are more sustainable, self-sufficient. And so we want to make sure that they have the tools and resources to do that, so they don't go from program to program to program. We want to make sure that they have the skills, tools, and resources to be able to be more self-sufficient, so they don't have to be in the system, so to speak. So what we're going to do then is to get a chance to go into some breakout sessions. And I see Krista has a comment there to include or re-entering the system. Thank you for that. I do appreciate that feedback there. We can definitely capture that. I know the staff are taking some minutes as we go through the meetings here. So what we want to do is to get a chance to go into these breakout groups, and we have different facilitators. And so as we, again, take a look at what these impact statements are, those 2 impact statements, I want to try and create a connection. So I challenge you as you're in there, and we have facilitators in each of these. Let's pull out some of those connections. So how is the work that you're doing, how is that going to be related to the work that we're talking about here, and these impact statements and these different populations, and our bigger vision with the Wellbeing Collaborative? So Matt, are you ready to break us out? And how long were we thinking of getting a chance to be able to be in those breakout sessions?
Yeah, I am ready whenever. And I think on the agenda we had 20 minutes. But if you guys would like more time, we can definitely work with that. Denise, is 20 minutes still about what we want? Okay, perfect. So yeah, so first facilitators, I have Denise, Nadia, Travis, and then shout out to Abby and Emily. They will be facilitating some groups as well, and each room should have some staff support as well. So I'll go ahead and open those up, and it should automatically hook you guys into your rooms. We've got about 10 of you in each room, and then I will best to give you a heads up, some countdowns for when we're gonna yoink you back in here, but you'll have 20 minutes, and I'll open those up now. Oh, one second.
I was just going to ask if we could post the statements in the chat, and Michelle landed there, so thank you, Michelle.
Perfect. All right, we will see you back here in about 20 minutes.
Thank you, Matt, for muting us all before we come back in, because I think I was in mid-sentence.
Happens every time. I apologize.
Do we have everyone back now? Okay. I'm going to turn things over in just a second here to Denise, and she's going to help us kind of just do maybe a report out of the things that we heard, but just a high level comment from the breakout session, the breakout room that I was in. We had a really good discussion. We were able to meaningfully connect the work that the people within our breakout session, their agencies that they come from, and the impact statements that we talked about. And I think what's really important is I'm seeing through the conversations our evolution of us getting to this collective impact model. We have people are understanding that we can work together to this greater good and have aligned goals, and nobody's telling you or your agency that you're doing it wrong. You need to measure something differently, that you need to report out through some other agency and someone else. I think what this is just an understanding that we're all rowing the boat in the same direction, and let's be able to capture all of that work. We agree we're going the same direction. Let's capture the work, and let's be able to show our community the impact that we're able to do together. So it was just really awesome, as from a couple of years ago when I started with Denise and the team here, and not knowing that I'd be sitting here today leading this discussion, but it really has been great to be able to see our evolution, and I really believe we're fully swinging in that collective impact model now. So thank you, everyone. Denise, go ahead.
Thank you, Travis. I don't know about you, but halfway through my conversation with my team, I just wanted to go out and do a little happy dance in the hallway. I just we are making progress, which is just fantastic to see. So I see Krista Fritzen, you have group 4. Let's just start there, and then anything that Krista doesn't share that are shared in the other groups, we will we'll come back to those other groups. So why don't we have Ms. Pope being on the next one up after Krista. So go ahead, Krista.
I'm kind of jealous that she got a little warning, but I got this. I'm sure I can handle it. We definitely saw, what I've done is kind of create some themes. We had multiple people sharing, of course. In terms of increasing access, themes really were about mentoring, and particular people talked about their mentoring experiences and the programs that they're involved with, specifically that are increasing awareness among community members. And part of those subgroups are also receiving awareness by joining in with community partners or going out to community partners such as Richard Young or schools or other programs that then educate the subgroups, like say YAB. So those young folks are learning about it, and then they can also become mentors. And so there's a systemic piece to that as well. Likewise, with those who teach part-time, we had a couple people in our group, Bryce and Tiffany and myself, and maybe somebody else who teach at various levels. And even like the prevention for the 0 to 3, they are doing prevention by offering information, increasing awareness. Again, that's the theme of increasing awareness, connecting with community members, connecting with students and younger people, sometimes connecting them with professionals and other providers, but oftentimes lay people or community members, giving them information by getting out into the field. And then those people become the mentors too. So teaching, education, increasing awareness in terms of access, that increased awareness and making connections between the organizations and people who are being affected by the programs with those individuals. In terms of number 2, prevention of reentry, much like the dynamic that I just described, but some more specifics would be, these words weren't used by the particular people, but keeping people involved, keeping those individuals that are already doing the other work, keeping them in those programs longer so they develop greater confidence and strength to be able to then become sustainable entities in our community to provide services, increasing the workforce, as well as being mentors in those intermediate areas as they're becoming professionals. Those are themes I heard. Those words weren't necessarily spoken in the meeting, so anybody in our group, please feel free to correct that if that's inaccurate. I just connected some of the dots, or tried to. in terms of some specific, this is kind of systemic in that an individual is very involved with nutrition and being able to help with education about nutrition, and then also put together boxes for people who are nutrition, have nutrition deficits or food deficits, etc. And so again, I think that looks at systemically how that helps to, by using that resource and doing the educational piece, can help prevent re-entry into some of the programs. Likewise, some of those folks that are involved in healthcare management, when people are in crisis and they're doing interventions to make sure that the education and the information happens during those days, during those interventions, but also then is carried on, and we as providers follow through with making sure that, or attempting to make sure that those pieces of information are followed through with. So maybe the time of use of resources is shortened, and then they can also it can prevent that reentry. So increased awareness, education, increasing the workforce pipeline, like through Beacon, promoting individuals and increased awareness of mental health, and educational services were all some of the common themes.
Thank you so much, Krista, for sharing on behalf of your group. Jaylee, am I pronouncing your name right? I believe you're next.
Yes, so in our breakout room, we talked a lot about increasing the access to resources, programs, and services, but then also looking at how we can reduce those people re-entering into the system. So I definitely got to meet quite a few people that definitely had a lot of different backgrounds in these situations. But just a lot of things that we talked about was, first, we recognized of how a lot of kids don't have especially resources, these systems, and especially sometimes, like I know Ms. Andrews pointed out, that a lot of the frontline workers for those on the ground and really interacting with people in terms of mental health and getting aid, they don't always have the time to perfect in how they know where resources come from. So providing a place where resources can be consolidated was really important to many of those in our group. And then also looking at how many of these resources can be very helpful to people. And I also pointed out how, especially on the youth side, that some kids don't always want to reach out to adults. And so having those open for especially us on the youth side, and looking out into how these different people's types of work also play into these impact statements. And so hearing those of especially how those resources can be consolidated, but then also looking into the impact of how we can start education and access to these resources early, such as in high schools or to other students, then that can help them better in their futures. Like I know Mr. Owens pointed out how in their high school, they really emphasize economic and financial literacy early so that those kids are better able to then have budgets later on, seeing as some services can only help adults increase their budgeting awareness so much. And so having kids know those things early is very important. And then also we talked a lot about at the end of realizing how people get into crises. And I know Miss Kennedy with the Brain Injury Alliance, she noted that sometimes it can be confusing to people of how they've ended up in this crisis, and they may have been better off at one point, but with these different notes, then it's easy to see how those can be lost and not everyone can understand this. And so then we also got into how behavior can play a role in how someone acts or how they deal with situations. So then also those around them can be better able to handle a person's behavior when they might be dealing with a situation and they might be coping in that way, but not realizing it. Is there anything else that I need to add, or anyone else in the group can add anything else that I may have missed?
I just want to say a shout out to you for doing a great job at reporting out, for joining this meeting. Jaylee is a senior at Shelton, is that correct? Yes. And so here's a future community partners leader. So thank you for doing an excellent job. Do we have anything else from that room? I know Sarah was taking notes for us. I think you did a great job.
I just want to say congratulations to Jay Lee on extemporaneous speaking. Woohoo! State champ. Yay.
Thank
Sorry.
you.
I think she also covered all the major points. She's got a memory like a steel trap.
Thank you.
Are you feeling all the love and appreciation today, Jaylee?
Definitely.
Well, thank you for jumping on this call today. We are very appreciative of your time and your commitment also to the Buffalo County Youth Advisory Board. Thank you for that. All right, I think next up, let me look at my list, is Travis's group. Do you have any other elements to add that have not yet been mentioned, Travis?
Oh, what a tough act to follow. Who decided that I had to follow her? That was incredibly tough. Well done. I'm impressed. No, we, many things like the group has already talked about. So we tried to create a connection between the work that people in our breakout session do and how that interacts or intersects with the impact statements that we talked about. And so just some of the things were, we talked about access to childcare. So the access came up from the first impact statement, but then how that plays into the second impact statement about preventing persons from entering the system. So I think having the access and these preventative measures available and accessible to folks then can prevent that, obviously, going into the second impact statement of being able to or having to enter those systems. We also talked a little bit about a number of different programs and resources that are out there, whether that's trauma training and how tobacco-free resources and how people access those kinds of things. And so we did have some good discussion about an awareness of those. And in some situations, that's tough because you don't know you're looking for trauma training until you need it, or mental health services or whatever it may be. And so you're not fully aware of all of that because it doesn't affect you. And so that can be difficult. We've talked about, this group has mentioned about how other places or communities are, keeping a centralized repository, or is it decentralized, and how do we get the information to people? But it can be really difficult because a lot of times people are going into these situations, whether it be in some type of a crisis mode. And so they're not just sitting there spending the time to be able to understand and just say, oh, okay, well, I now have a need for mental health. And good news, I've been researching mental health access in this community for a decade. And so I'm fully aware of what's out there. I think that type of knowledge level in these situations usually doesn't exist. So that's difficult there. And then just being able to talk about, again, more having the access, and some of that could be a little bit out of our control, but if someone has a certain type of payer source that isn't taken by healthcare providers in town, where are they going to get some of those services? Because we know that can escalate quickly. Someone with a sore tooth who can't be seen can end up in an ER with a systemic infection and be having high dollar resources that they wouldn't need if they were just able to get in and get an antibiotic or get some of those types of things taken care of. And so, we can sit here and discuss all day long the payer habits of Medicaid and other payers, but what could we do here locally to be able to provide some type of access or resource like the healthcare clinic or whatever it may be. So those were a lot of the discussions we had, but really good discussions.
Thank you very much, Travis. You did a great job of following Jay Lee too. You competed well. I'm sorry that you don't have or maybe, are you a speech champion as well?
No, I am not a state speech champion, so I was a little nervous following.
You can still have dreams, Travis. So thank you so much for sharing that. You brought in a couple of elements to that from your group that I don't think we've heard yet as well. So Emily, do you want to take this next step and share from your group?
Sure. Hi, everybody. So in our group, we talked a lot about that proactive piece versus reactive. So a lot of the agencies do that prevention piece so that families and children don't come into the system or don't have to, get on state services, but those that work in that increase access to information resources Some of that is reactive to current situations for people and what that looks like. So we talked about educating on ways to stay healthy and just different things that we're doing in the community to move the work forward. There's a lot of prevention programs out there. Nikki talked about her opioid use prevention, medication takebacks. So a lot of it is reactive to situations that we already have, but proactive. So again, we can look at what's going on in our communities and build self-sufficient clients that we're working with. We saw, for the most part, everybody fitting into both of the impact statements. There's a lot of prevention and that increased access to different resources as well. That's a gist of it, since everybody else has done such a great job sharing out, and we fall under a lot of those categories too, unless anybody has anything else to add.
I am not hearing anything else, Emily. Thank you so much for sharing on behalf of your group. As the phenomenal facilitator that I am, I forgot to ask somebody to report until we were almost done. So when I do that, I get left with the bucket. So I'm going to share a few things, and then I'm going to call on Alexander Dillon to share a little bit more from the early childhood that we haven't heard yet. So we had a really good conversation about the early childhood. We also talked a little bit about the suicide prevention elements in the community and how we can see that aligning with those impact statements as they are drafted at this point. And Nikki Gosman with the Safe Center also could see some really nice connections to interventions and prevention pieces. So I think some of the groups have mentioned that intervention piece, as well as the prevention being that proactive versus the reactive element in this work. We also had the benefit of having a couple of retired board members, and Carol Renner and Carol Schwartz, who've been with us from our beginning times in the mid-90s. And so it was really interesting to hear them talk about the importance of using a common language as we present this information. They see themselves as like the spokespeople of this work, since they may not have prevention systems that they're moving forward or work for an organization that has an accountable goal or activity or funding. They were coming at this from a perspective of just a champion for the work that you're all doing, and how do they share this with others. And I think one of them, I think Carol Renner said, I always think about the work after I leave one of your meetings and say, how do I share this with the Rotary Club? And what kind of language do I use and able to share that information? And sometimes we get a little technical in those conversations. So I thought that was a really important piece. And I think the word that really started to kind of jump out at us was system. We felt like it was almost a negative connotation. And then how do we start to be able to put some language in that still achieves what we're all envisioning our work could be, but also understanding that we want to be able to talk to somebody in the grocery store line and be able to have a common conversation about the work. I think Jamie jumped on a little bit later, but totally saw the mental health and the lived experience. I don't think we've mentioned that yet, but she could definitely see how those with lived experience could help inform this work. And let's see, I think that's most of what I heard. And then I'm just going to hand off to Alexander Dillon to see if she would kind of recap the early childhood pieces as well.
Just quickly, I think we absolutely see the connection between access and prevention. One area that came up was just to double check that technology is covered in those categories that are listed in the access statement, particularly access to laptops and computers to be able to provide professional development for early childhood educators. Another key area was brought up by Danielle with Smiling Faces, which is employment, and not only employment, but retention and hiring quality employees, and so recruitment and retention. And that led to a conversation about thinking about how partners and stakeholders that are a part of this group, how do we create perhaps pathways to employment and leverage resources to make those pathways easily communicated, easily understood, and easily accessed. And then retention is a whole nother piece. But I think that key element of employment is something that there's an interest in having more explicitly stated, perhaps in the statements that we have.
Thank you all. This is really good information. I am trying to just kind of process it all, but I know I'm going to need a night to sleep on it, as well as many of you. So we'll consolidate what we're hearing from everyone, really kind of put some thought to that. But the overall objective of what we want to accomplish today was to ensure that these two impact statements that the steering committee was recommending to the full collaborative are on track, that we are putting forth two areas that everyone on this call and beyond that could see that their work is a part of that, because in order for us to move this collective impact work forward, we want people to be able to see themselves and how they help attain those overall goals. So I believe at this time, and maybe I should ask Travis, is there anything else you want to say, Travis, before we go into a poll question in regards to that?
No, I don't think so. I think we've captured what I was hoping that we would get through today. So I think we're ready to move on.
Fantastic. So Matt, if you would like to go ahead and throw up that first poll question we have, and we'll give everybody some time to process that and answer. We're getting close. We're at about 70% of the answers. So I'll give everybody a little bit more time. I'm going to guess the people who haven't answered yet are staff, and that might be why I haven't got to 100%. So I'm going to go ahead and end the poll and share the results. That's not bad to have 75% of you ready. We don't ever expect to have 100% of everybody ready, because some of you, this is your first meeting, right? So you're really just trying to absorb the information that we've shared. So this is a really good place to be in. Travis, thoughts?
Keep myself unmuted. No, like you said, I think we know that with a group this large, it's going to be tough to get people always at 100%, because we're all in different stages of processing or in participation. But I'm very happy to hear that we've got a really good consensus on where we're going with our work.
All right, sir, do you want to talk a little bit more about the timeline pieces as we get the next poll question ready to go?
Well, I touched on that a little bit earlier, but I just for myself and for all of you involved, I think as we have other work that we're working on, and this is something that we're passionate about, but we're not in it every day like the staff are, who are helping to facilitate and provide that backbone support. I think it's good. As much as I enjoy the infographic that we have around our structure, I think it'd be good to have some sort of visual representation for us to be able to see where we've come from and kind of what stage we're in now, how long we would anticipate being in that area, and then what our future continues to look like. So we're going to work with the staff throughout the next month here and see if maybe within a short time frame we can have something back to all of you to be able to digest and just kind of understand, and so you kind of see the bigger picture and get some of your feedback there.
So early on, we had a piece from Nebraska Children and Families that moved the continuum of collective impact from emerging to thriving to maturing. So we took some of the questions from that emerging collective impact, and we're going to throw these up for you if you want to go ahead and start that poll so people can start kind of processing this. There's 9 questions, so it's going to take you a few minutes to kind of process through this, and I'll stop talking so you can kind of think about it and answer these questions. We're hopeful that here in the next few minutes, we would be able to kind of come back to this and see where we maybe have some gaps or what we've really been successful in completing so far. And can you see the whole question?
It's cutting off a little bit on my end. I don't know if the others.
I'm enlarging it on my screen. Is everybody else able to see that or not? I'm using my arrows to make it bigger. You can also use the box up above.
We can do that independently, but when you did yours, it didn't affect mine, but I could do it just by pulling down on one corner.
Okay. All right, well, I'll go ahead and I think I've launched it, so you can go ahead and start answering those questions. We'll just give you some time to work through that.
I just see in the chat box, Abby and Estella look like they haven't seen the polls. If you go down to the bottom bar there where it says the mute your video, there's a poll button. You might be able to click on it and it might launch the poll for you. So try that and let us know. Also, hi, Marina.
This is Carol, a clarification that the subtitle says somewhat not emerging. Is the word not, should that be eliminated? Somewhat not emerging, should that just be somewhat? I mean, it's a little confusing, somewhat not emerging for the second choice. You see what I mean on the survey?
I'll have to say I can't see those pieces. All I can see is results. So I'm going to need to lean on the staff. I don't see, I'm the only one with a different screen. So maybe, Michelle, you might be the only one that can answer some of these questions.
I thought the not might be a mistake. It seems like it should be not emerging, somewhat, neither are fully emerging, but maybe I'm reading it incorrectly.
Carol, I think, so there's two answers that are like no, in essence, they're not quite. So not emerging, somewhat not emerging, neither, and then somewhat emerging, fully emerging.
Well, I didn't see the somewhat emerging. I thought you had to go from neither to fully.
To all the
Maybe
way.
I didn't open it well. I'll look, yeah, to look again.
Yeah, you might have to, and you can also go into the top right-hand corner and click the square maximize and it'll make it full screen for you on your device.
Yeah, I didn't open up fully. I just went to what was presented on the screen. That was the problem. Thank you for fixing
There you
it.
go. Thanks, Carol.
We do have a little, oh,
I
go ahead.
I still cannot see the whole question.
Yes, I can't either. I keep trying different things.
And I do have a 2:00 meeting, so can you maybe send one of those out for us?
Yeah, I think we could follow up with a quick survey to all of you too. It sounds like it's a little bit challenging. We were a little concerned about having these many questions up here. So why don't I go ahead and just close it for now. Let's talk through it, and then we'll continue to keep this survey active for others to participate. I do need some help, however. I don't know what some of it means. So I'm assuming the blue mat means somewhat not, and the yellow is strong. We have, like, when you say, do collective partners recognize the importance of cross-sector teams? Oops, you can't see it yet. Sorry. You can see it. Do collaborative partners recognize importance of cross-sector teams? I'm thinking the yellow means that is yes, that's a very strong 5 answer.
Yes, you're right, Denise. If I'm not sure on your end, if you hover over those colors there, it should it gives me a percent. If it doesn't for you, I can share. So on that one, 52% of those that were able to answer said fully emerging, 43% said somewhat fully emerging, and 4% said somewhat not emerging. Do you see that now?
Perfect. Yeah. Does everybody see that now? There's like a floating screen on top of it. Or maybe you each have to do that on your own screens. So what that says is the yellow answer means it's fully emerging. So that's a really good response. 52% of us see that the collective partners are recognizing the importance of these cross-sector teams. The other piece, the next question, question B, we're asking, are the collaborative partners willing to meet and address the well-being of residents? And we're really looking at that somewhat in that teal color to fully emerging in the yellow. And that's probably almost 90%, I believe, that's coming through on that. So that's a really strong support for the work that you're doing. The third question, are collaborative partners willing to meet or organize to gain greater understanding of the community problem? Along the same lines, a very strong 90% or so there as well. I think what I was guesstimating is this question D might be the area that we would probably dig into next. Are collaborative partners aware of the resources available to meet needs? And so that's where we kind of lose that really strong yellow that we've been seeing, and we start to see somewhat, but not fully emerging. So that probably tells us as a group that might be an area for us to focus on, as the awareness of the resources that we have available to meet those needs. And from there on, you see that trend continue. And I think that's what we thought we might see, but we really just kind of wanted to check in. I think from there on, the questions that you're asking are areas that we can continue to work on. Travis, any thoughts as you kind of look through that?
Yeah, I'm having trouble getting unmuted. I couldn't find my mouse on my different screens. No, I didn't have any different thoughts on any of that. I thought, as I took a look at those results at a high level, seeing the positive on those being anywhere between low 80s to upper 90s, between the fully and somewhat emerging, I thought that was great. I thought they were really good responses.
Nadia, any ahas as you look through this?
I have to say, I don't know if it's on my end, but I am not able to see those questions. But my aha is, and I'm just saying that in case anybody else is in my boat, then they don't feel like they're, but just great to hear all the conversations and all the collaborations and possible collaborations, and the fact that we're headed in the right direction. So that's a reaffirming aha.
Yeah, I think as I look at it too, age, the that first the color of knowledge coming forward. So I think
I think we're losing Denise there, and I know that they were having some issues at the office today with the internet. So I'm going to go to Joanna until Denise gets that fixed and see. Joanna, do you have anything you want to leave
Well, I
us
think
with?
it's interesting, and we all recognize we didn't get enough people to, be able to complete these questions. So we take it with a little bit of grain of salt. But, it's kind of what we would expect, that as you get further down, you see less yellow. More yellow is better, obviously, in the simple sort of look at this. But I'm not surprised that we still struggle a little bit with number 8 in terms of end user voice informing collaborative decisions, right? We recognize we still need to do some work on that. And I think the question about, are we already doing collaborative work in this, doing this work in the collaborative, to some degree you are. I mean, as I listen to that over and over in your breakout rooms, there's a lot of overlap to the work. And I think that's what's really exciting about these kinds of community conversations, is that you begin to, discern together, where do you have aligned interests already? And then where are some of the gaps? And I think both of those things come out of this conversation, which is really important, because I think that is going to be, as Denise says, some of the ongoing conversation now. We look for the natural collaboration, natural opportunities to partner, but then you have to look for the, kind of tough questions about, where do we just see gaps? And I think in each organization, you're going to start to share more of that, and that will require more trust building across the community, right? Because we're very good at acknowledging where we have successes, but it's harder to say these are the places where we're falling short a little bit, or we can do better. And so I think one of the things I would encourage each of the folks who are on this call is, when you go back to your organizations, to kind of extend this conversation into your individual organizations for a bit, and just asking your own teams to be thinking about those 3 simple RBA questions. What are we doing? How well are we doing it? And is anybody better off? And when you get thoughtful answers to that, you might find yourself, we could be doing better if we are in collaboration or partnering with others in this collaborative, and that kind of opens the conversation up more. So I also think it's very interesting for us to consider what is preventive and what is access. And I think we get very caught in the process of providing access that sometimes we forget to go upstream, as many of you have said, and ask ourselves what percentage of our work needs to be focused on that prevention piece. So I think it'd be very interesting, Denise, as you said, to send that poll out to everybody and have a chance to get a fuller view of this, which will be fun. And we can share that at the next meeting. But all of these questions just cause us to pause a little bit and think a little more about sort of where we are. When we get down to thinking about how we're going to measure this, it'll be interesting to ask questions about what you're already measuring, and what data do you already have? And then what data would you like to have? And so those things will move the conversation forward as well. So I think this has been a terrific conversation again today.
Well, everyone, we are getting close to our time here. I see that Denise put in the chat. So it looks like our next collaborative meeting will be on the 27th of April at 12:30. So if there are those that you would like to invite, please make sure to do that, so we can have all of our voices at the table. And that's it for today. Thank you everyone for participating. We'll get you out of here, right on time. Thanks everyone. Bye.